Hello, friends. I'm Dr. Rosa Oliai, obstetrician and gynecologist. In this episode of Health, I'll be talking to you about menopause. This topic is very important because 30 years of women's span of life is spent on this period of menopause. Usually, when we see that the age where menopause starts is between 45 to 50 years. So this is a period of time when usually there's hormonal changes in the body of a woman. Estrogen hormone decreases, wherein the menstrual cycles become either irregular, sometimes heavy, sometimes less. So there's a lot of irregularity in the hormones which play. And so sometimes, you feel that, for about a period of time, 6 months to 1 year, you don't get your periods. There's nothing to panic because this is very natural. If you see the structure of the uterus, we have ovaries by the side. There is a hormone that is secreted from here, that's estrogen, which gradually, because of the decrease in the hormone which plays on the uterus, there is no menstrual cycle. So the fertility, the ability to produce and become pregnant vanishes. In this period of time, however, there are certain symptoms, and more often when patients come to me, they come with complaints of either irritability, mood swings, hot flushes. All of a sudden, you see at night you're sweating. So this disturbs your sleep at night. These symptoms plus other issues related to sexual issues, you have dryness in the vagina, you have certain white discharges that comes, itching problems, hair fall, pains and aches in your muscles, which is very, very common. There's nothing to panic about this because these, symptoms stay for around maybe 6 months to sometimes to 1 year. Now it really depends about your surrounding areas that you're in, especially your family members, your husband, your children. They have to support you at this time because you need a lot of mental support. Besides, of course, you'll be visiting your doctor. There are certain blood tests that needs to be done. I would say it should be an annual process for you above the age of 50. So these tests will help you to keep your blood cholesterol in check, your other functions of the body in check, your especially bone level of vitamin D3, calcium, because in the long run, the problems related to menopause, which would cause later on in life, would be osteoporosis. So, decrease in calcium level, vitamin D3 level in your body will make your bones pain. You have problems in walking. You may also land up in having high blood pressure in this stage of life. So, you need to have your regular checkups done with your doctor. Sometimes, forgetfulness, later on, it may go on into Alzheimer's and, other issues which are related to heart also. So it's very important for you to understand this stage of life and not to take it, very lightly. The best thing would be to be aware of it and to know how to overcome certain issues. So in short, if I tell you, would be a good lifestyle change for you at this period of time. You have to decrease your carbohydrate and sugar intake. So salt, sugar, flour, white flour, all these needs to be a little checked. What we were eating before 50, you need to control that. I would also say that if you can't go to the gym at this stage of life, you've never been there before, now is the time to do a little walking. So if you do 45 minutes of brisk walking every day, that could suffice and keep you fit. Try to occupy yourself in some good work. Don't try to retire yourself. You're not old. It's the next stage of your life where you have to be happy. After all, we talk about health to be not only physical, social, mental, but especially spiritual well being. You can start doing a lot of yoga and meditations. There are such beautiful prayers for health that you can say. Involve in activities of service because service brings happiness. So there are a lot of things that you should be able to do this. Try to have friends, go out together with all of them. Enjoy your life at this stage. You've done enough. You've worked hard. Your children are now well settled down. You don't have to think about the kids because they are well settled in life. They are doing their best. This is a time for you to look after yourself. And for all those husbands who are hearing this video, you must support your wife. Very often, I have patients who come to me with the husbands thinking they need to go for a mental support to a psychiatrist or a psychologist. It's a no to you. It's a stage of life. Give her time, she'll overcome it. So the symptoms don't stay for long. However, there are certain medication for certain diseases and problems that is there with an individual, which then has to be escalated and you could be referred to the proper person, such as skin specialist or any other issues related to your bone to an orthopedic surgeon. So do visit your gynecologist as your first check doctor and you'll be fantastic, having a beautiful time. So we really want you to be fit at 50, strong at 60 and independent at 80. Have a lovely time and enjoy this period of life, which is going to be 30 years in your lifespan. Thank you.